Good morning. It's good to be with you this morning, and I want to take a few minutes to talk with you about optimizing your hormones. This is a very intriguing subject, and there are really disinformation out in the public right now. So I want to explain to you exactly what we're talking about and the differences between the different hormones. The four big ones that I want to talk about is estrogen, progesterone, testosterone, and thyroid hormone. This will be in multiple parts because I want to try to cover it as thoroughly as I possibly can. Today, we're going to deal more with estrogen and progesterone. And as everyone knows, you hear about women with hot flashes and night sweats and mood swings as they enter the perimenopause and menopause. And this is a very common complaint that I hear from women, and it's very frustrating for women because they don't really have a control over some of those aspects. It just happens to them. It has always been noted that this is because your ovaries are fading and you don't have enough estrogen production. And true, if you can replace that estrogen, you do help control the hot flashes and the night sweats. But there's also a big difference in estrogens. You have synthetic estrogens and you have bioidentical estrogens. And there's the impact is extremely important to know the difference between the two. Now, let's take, for example, about in early 1900s, I believe it was 1991, there was a study started that was a 10 to 15 year study on the effects of estrogen and progesterone on women and any risk factors involved with that. Now, that study got released to the press before physicians ever had a chance to look at it. They didn't. When they did, they came back and said, wait a minute, this is not a very good study. There's a lot of flaws with that. But it had already hit the evening news, the newspapers. At that time, I had women calling me constantly complaining of hot flashes and night sweats because it scared them so much they just stopped their hormone replacement therapy. Now, I've been a big proponent of hormone replacement therapy my entire career because I've seen the benefits. Yes, in the past, estrogen has been touted as the cure-all for everything, and I think that kind of pushed the envelope by a large amount, but it does have a very beneficial effect for a lot of women. But the thing that didn't make the news was that they continued to follow all these women for a long time after that information came out. And it came out that, wait a minute, we're actually seeing a reduction in breast cancer in women who took only estrogen. It was only the women who took the estrogen with hydroprogesterone or Provera that actually had the increased risk of breast cancer. And as they started analyzing it, now they know it was probably and most likely the Provera component that actually caused an increase in breast cancer. But none of that made the news. That wasn't headline news. And so it has been up to us as physicians to pass this along. And unfortunately, unless you really dig into the medical literature, a lot of physicians are still advising patients against hormone replacement because they don't know all the facts. And that can happen sometimes. But the important thing for us to remember is that, one, estrogen by itself, even though it was a synthetic estrogen, did not increase a woman's risk of breast cancer. And if you ask women, why do you not take hormones? The big fear is, I don't want it to cause cancer. And that's understandable. But that's not correct information. Now, what's the difference between synthetic and bioidentical estrogen? One, bioidentical estrogen is exactly the same estrogen that your ovaries produce prior to menopause. Synthetic estrogens are a little variation of that, and they will control the symptoms to a large degree. But the big concern is, does that increase your risk of blood clots? Can women who have had a previous venous thrombosis take estrogen replacement? And with synthetic estrogens, most of the time they can't because of the fear of the increased risk of blood clots. However, bioidentical estrogens have been studied extensively and have not been shown to increase a woman's risk of blood clots, has not shown to increase a woman's risk of breast cancer. In fact, a lot of the studies now are showing that there's probably a slight reduction in the risk of breast cancer in women who take estrogen. So there's a lot of information out there that we're going to continue to discuss in our future sessions together about why there's an advantage and not. Progesterone is a very important hormone for one big reason. Progesterone is, and I'm talking about a non-synthetic or a more natural progesterone, is needed to protect the uterus in women who are taking hormone replacement therapy. It is not necessary all the time in women who are taking estrogen if they've had a hysterectomy. The progesterone is there so that the uterus is protected against continuous estrogen stimulation without any progesterone. You know, when you're young and you're ovulating every month, or you may be on birth control pills which have both hormones, etc., you produce both estrogen and progesterone. So therefore, the uterus is protected, and that's why you rarely, if ever, hear of young women having endometrial cancer. But if they don't take progesterone in the menopause and they're taking estrogen, it does increase their risk of endometrial cancer. So it's very important that if women are taking estrogen and still have a uterus, they should be getting a source of progesterone, preferably a natural progesterone and not a synthetic one like Provera would be. I appreciate your attention today. I've got a couple of calls here. We'll try to get back to you on that to answer those questions specifically. But Mary, yes, Mary, we do accept new patients, and we do work with patients on optimizing their hormones. And we certainly would be more than happy to see you and work with you on that aspect of your life and trying to get you back to a normal lifestyle that you're used to without all the aggravations of the hormone reductions that you have. Coming up in the next week or two, we're going to be talking about a big subject, and that's testosterone. And there are so many myths out there on testosterone that I want to discuss with you, because now we have the long-term studies that show the benefits of bioidentical testosterone. And we want to go over that along with the ways that you can take hormone replacement therapy. Synthetics come in patches, they come in pills. The bioidentical come in creams and pellets. And all are available, all have their advantages, but the bioidentical seem to have much, much more advantage over the synthetic. So we want to go over that in more detail as we go forward. Please send in your questions if you want them answered next time. I'll be more than happy to try to answer those for you. And again, thank you for joining us this morning. It was good to be with you, and I look forward to sharing with you again in the near future.